So what's coming into effect on May 1st is a program called FAA BasicMed. And what this is a program that was legislated by Congress and passed last July. And what it involves is an alternative medical qualification pathway for private pilots. These are pilots that are not for hire, that are flying basically recreationally in certain types of light airplanes. The pathway itself, the pilot has to have a valid state driver's license. They have to undergo a medical evaluation by any state licensed physician, and then they get online and take a free educational course that's available that covers risk factors of flying as it pertains to their medical conditions and recognizing incapacitation, things that might lead to incapacitation in flight. Mayo Clinic is providing, there'll be one of two providers nationally of this online educational course, and we feel that that's going to be a great addition for these pilots moving forward. The beauty of our course, and part of the reason that we've done the course, is that it really introduced the concept of every time that you are pre-flighting your airplane, the pilot is the most important part of that safety chain, and each pilot should be sort of pre-flighting themselves in terms of that how am I doing question, am I really ready to take on this flight? We've tried to keep it so that it is efficient as possible. So when I say that, the entire course runs around 90 minutes. It involves the pilot needs to sign electronically attestation statements that they understand how the program works, and that if they do encounter any medical condition throughout the time that they're flying, that they do stand down from flying. Once they get through the attestation statements, they take 6 different modules. Some of them focus on things like recognizing symptoms that might cause in-flight incapacitation, knowing something about drugs and their side effects, prescription drugs and obviously illicit drugs, and things like just how to estimate risk. Risk is something that we know that never goes away, but it's how do you manage that risk in the long run that really makes a difference. And then finally, we talk about the importance of a preventive health assessment and the importance of working with your healthcare provider to constantly be maintaining your health. And finally, the last module is focused on what happens if you do get a medical condition, what are things for which you do need to stand down from flying, and then what happens after that. What does the pilot need to do to get back into the cockpit again at that point? So what's called the Comprehensive Medical Evaluation Checklist is what's associated with FAA BasicMed. It involves all of the basic organ systems that we would do in a regular flight physical, only it's any state licensed physician could do it. And so what it's relying on is that state licensed physician is actually performing the entire comprehensive examination. The electronic course is required to be completed every 2 years under BasicMed, and every 4 years for the Comprehensive Medical Evaluation Checklist. I think in particular what's very critical about these is that doctor understands that they don't need to know everything about everything when it comes to FAA regulations, but they should have general familiarity and understand that it is up to them to make that certification or qualification decision. And in doing so, it's important that they order whatever tests they feel necessary to establish that that particular pilot is medically stable for that particular condition. The physicians need to know that they are perfectly, they should feel perfectly amenable to ordering whatever testing they feel fit, and to pick up the phone and call FAA designated examiners to help as far as resource for answering the questions about clinical stability. Mayo Clinic has been involved in taking care of pilots since I say the beginning of time. In 1928, Mayo had the first 10 flight examiners appointed by what was called the Civil Aeronautics Board at the time. And from that time on, we're in our 75th year of taking care of pilots and doing work, research, education, and clinical work in aerospace medicine. And this is just